We've got 3 paramedics that have tested positive in New South Wales at the moment.
As intensive care paramedic Brett Simpson prepares to start his shift in Sydney, he's risking his life to help others. But some of his paramedic colleagues won't be working with him today.
If you attend a COVID positive patient or you have a suspected COVID positive patient and your PPE that you have on doesn't meet the standards, or it's a mask that isn't specifically fitted for your face, you're going to find yourself in 14 days of mandatory isolation.
Ambulance New South Wales did not confirm the numbers of paramedics currently in isolation, but the union estimates it's as many as 10%.
So we've got about approximately 200 staff in isolation at the moment. That's on a background of approximately 2,000 staff across the greater metropolitan region of Sydney.
It's just one of the potential problems for frontline workers responding to COVID-19 after a string of workplace infections for medical staff during the current outbreak. A fully vaccinated nurse at Westmead Hospital's COVID ward returned a positive result last week, despite wearing full protective equipment at work. And also last week, after an anaesthetist working at Liverpool and Campbelltown hospitals tested positive, colleagues raised concerns about the availability and effectiveness of their personal protective equipment, or PPE.
We know that the anaesthetist didn't have adequate PPE. They were wearing a surgical mask. We know that the impact of them working at Liverpool Hospital, as well as a few other incidents, has left the Liverpool operating theatres really running on skeletal staff. I'm hoping that New South Wales learns from what happened in Victoria. I mean, in Victoria, of the 20,000 cases during the second wave last year, over 4,000 of those occurred in health workers, and about 75% were acquired at work.
Hospitals are on high alert, even ones with no COVID patients.
Even though we're not a hospital that is primarily treating patients with COVID, the situation at the moment is such that people coming into the hospital could be infected.
The Chris O'Brien Lifehouse at Camperdown last week went into lockdown after a staff member tested positive, a test which proved to be a false positive.
Having a positive case, false or not, is really very disruptive.
However, this afternoon, New South Wales Health notified the hospital a patient who attended on Tuesday has since tested positive for COVID-19. In New South Wales, there are 118 COVID patients admitted to hospital, 28 of whom are in intensive care and 14 requiring ventilation. In Victoria, there are 5 COVID patients in hospital, 1 in intensive care, and in Queensland there's 25 in hospital and 1 in intensive care. In Melbourne, the state whose healthcare system was put to the strongest test last year, ICU nurse at Royal Melbourne, Nicole Sliwa, is pacing herself.
I guess what we've learnt from that as we sit here in 2021 in lockdown number 5, we're exhausted just like everybody else. You know, we're struggling.
Do you want a hand? Yeah, that'd be great. Yeah.
Watching everything unfold around the nation, looking at what New South Wales are facing at the moment. All I can say to my fellow colleagues up in New South Wales is that it is hard, but you've got each other. As long as you support each other, then there is a light at the end of the tunnel.
For paramedic staff like Brett Simpson, whose job it is to attend and transport COVID patients to hospital, not only their safety, but their ability to do their job is at stake.
Because it's all good and well to be building COVID wards and intensive care units, but if the paramedics aren't there to get you into those facilities, then what good is it?
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 7:30's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.